Good morning, Katrina Rothenberger, Public Health Division Director for Marion County Health and Human Services. As of today, we have 3,320 COVID-19 cases in Marion County, which includes 3,189 positive tests, and 35,693 people have tested negative, and 73 people have died. For the week of August 9th through August 16th, we have seen 283 new cases and a test positivity rate of 9.6%. Our positivity rate has fluctuated between 8 and 9.5% over the past month. We did see a 3-week decline in cases. However, this last week with 283 cases ended that trend in the decline in new cases. And I wanted to share a couple of data points that we discussed yesterday, if that's all right with.
Please.
In June and July and August, looking at the monthly distribution of cases, just highlighting the past few months. In June, we saw 551 new cases, and in July, 1,061 new cases. So far in August, as of the 13th, there have been 590 new cases. If we look at June and July, though, for hospitalizations in June, there were 57 hospitalizations. And in July, there were 60. However, between June and July saw almost double the amount of cases that June did with the same amount of hospitalizations. And so far in August, we've seen 33 hospitalizations. In June and July, there were 21 deaths. And again, July had about double the amount of cases as June did with the same number of deaths. So that was primarily due to long-term care facility in the month in June. And then in August so far, 6 people have died. The distribution of cases, hospitalizations, and deaths by infection source, about a third of the cases are related to household contacts. So this tells us that there are lots of people in homes living together that are getting infected. So this is one area for us to impact through some public health strategies, potentially utilizing our hotel for folks living in those multi-generational houses. And about 20 to 25% of cases have been sporadic in June and July. We're halfway through August. We're at about 40% for the month of August with sporadic cases. The deaths have disproportionately impacted folks living in long-term care facilities. Throughout the duration of the pandemic, about 60% of the people who have died have been associated with a long-term care facility. And in June and July, it was about 70% of the deaths were associated with people in long-term care facilities, and they represent about 10 to 15% of the overall cases. So this is also an area of priority for us as a county. And then just lastly, the distribution of cases is relatively similar to the state of Oregon with regard to sporadic household contacts and outbreaks. However, in Marion County, we were able to attribute fewer cases to sporadic, so more epilinks are found in Marion County, with about 25% or 27% of the cases in Marion County are attributed to sporadic or community acquired, whereas in Oregon it's about 35%. And that's throughout the duration of the pandemic. But we also look at our case rate as well. So we look at standardizing the population to assess risk and concentration of sporadic cases in a community. So in Marion County, about 237 per 100,000 cases are considered community acquired, whereas in Oregon it's about 185 per 100,000. So looking at the risk and concentration of Marion County, more are attributed to that sporadic or community acquired. So these are just all some data points that one alone can't tell the entire story. So we're looking at all of these broad points that we can help inform our strategies moving forward. So focusing on long-term care facilities, focusing on multi-generational and crowded housing. How can we help isolate and quarantine folks who aren't able to do so at home? So I think that's it for me for today.
Fabulous. Thank you, Katrina. Thank you for your presentation yesterday and all the information today. Any question?
Well, I don't know. I don't mean to cast aspersions, but watching the news yesterday, maybe it was this morning, but North Carolina opens up college and has trouble right away. Notre Dame's talking about trouble. And I note the Willamette kids were being dropped off yesterday, so something's going on. So you're already nodding. Are we involved in that or look anything to make
Willamette does submit a plan to the county, so we've been working with them.
Okay, that's all I really wanted to know. Good.
That's a good question, Commissioner. How many other colleges in Marion County? So we've got Corbin and Willamette. Are those the only two?
Yeah. Yes.
And they've both submitted plans to, so the governor's order to shut down schools doesn't apply to universities or colleges, private or public?
Universities are able to make those determinations of whether or not they're going to resume in-person classes. Some universities are choosing to do all online for fall term. So I'm less familiar with what the plan is for these two universities in Marion County, but I'd be happy to come back with that information.
I think that'd be really good to have.
Okay.
Thanks, Katrina. Yeah.
But yeah, I mean, the answer is yes. The governor has not prohibited universities from opening the way she's prohibited K-12.
Interesting.
Yeah. There was also an article in the Salem Reporter today that our school buildings are being used for childcare, but they can't be used for the same size classes for school. But yeah, I think we have some issues there with how those rules are being rolled out.
Really?
Yeah.
Oh.
Thank you, Katrina.
Thank you.